Many hospitals in the GTA continue to be overwhelmed, having to move
We are
patients
deep
to
into
less
wave
crowded
3.
facilities.
We knew what should have been done a year ago. There's really no excuse.
Ontario's third wave, deadly and devastating, yet very much a crisis predicted. We sat down with 3 doctors, all with open lines of communication to government, but with different windows onto the same urgent problem: how to avoid the disaster they saw coming. Dr. Adelstein Brown, considered the brilliant modeler and main point of contact between science and the Ontario government. His job, present the data.
If we could put the slides up, please.
And Dr. Brown's modeling would eventually make clear if Ontario crossed the red line of 800 patients in intensive care, people would die, whether through a lack of beds or a lack of people to care for them. Before long, Ontario had 900 patients in intensive care.
Am I missing something here, or is this presentation actually predicting a disaster?
No, I don't think you're missing anything. The cases will likely rise given the variants of concern, but there are a number of things that need to be weighed in making these decisions.
The number 800 is seared into my head. You had established that as or at least my interpretation of it was that this was a kind of red line, where if you crossed that red line, I mean, we've crossed it.
Yep.
Is that anything short, then, of an abject failure?
So I believe we could have done more to prevent the spread. What we've really got to do is get it under control and bring it down to a level that we can actually keep the health system running.
So it kind of keeps bringing me back to the same question over and over again.
Right.
How do you explain the inability or unwillingness of the government to follow what seems like pretty clear, obvious advice?
So I think it's an issue of weighing things differently. When we're giving this advice, we are really focused on how to get the pandemic under control. And that's really our sort of primary focus on this. They're weighing other things when they make those decisions.
But should those other things carry the weight of the factors that you are considering? Because what it sounds like is that to do anything short of what you suggest is a pretty clear forfeiture of human life.
Sure, there's a short term and there's a long term on this, right? It's my belief that the faster we get it under control, the faster that we get back to a normal way of interacting, the faster that we can have things open, the faster that we've got kids back at school. And I can understand that. And, if you're someone who runs a small business, if you're someone who runs a restaurant, if you're someone who runs a bar, and if you're someone in government who represents those people, there's a lot of reasons why you'd want to reject that outright. But we're not the decision makers.
The most devastating impact of COVID infection is in Ontario's Peel region. Just outside Toronto, it's where working from home is often impossible, and that so many families have so many people, several generations living under one roof. It's what some call the perfect pandemic storm. Enter Dr. Lawrence Lowe, Peel's Chief Medical Officer of Health. He's had to move fast, and at times on his own, closing bars and businesses, shutting down schools. He even took on Amazon, closing 2 of its facilities. There seems to be this big chasm there where the way you want to go about it is, you've made some pretty clear requests of the province, whether it be the stay-at-home order, whether it be a reevaluation of what businesses are essential, regional travel restrictions, all of these sorts of things that the province had been seemingly hesitant to implement. So how do you explain the gap?
It's a good question. Any sort of differences in opinion or approach are just ongoing efforts of our ability of the ongoing collaborative and consensus sort of nature of work that I think all of us strive to work towards, really.
Is it really just a difference of opinion, though? This seems to be about disagreement on epidemiology fundamentals, no?
Yeah, I think that's where I'm maybe a bit maybe sort of struggling to answer the question, in the sense that I'm ultimately a scientist at heart, and I have to speak to the data and the context and evidence of what I'm seeing in my community.
And what Dr. Lowe was seeing was a crisis getting worse, and government actions divorced from science. Remember this?
We're restricting all outdoor recreational amenities, such as golf courses, basketball courts, soccer fields, and playgrounds. We have made the difficult but necessary decision to give police and bylaw officers special authorities to enforce public health measures.
Those measures were a complete shock to medical experts who couldn't make any more clear. The problem was indoors, especially in crowded workplaces.
We've made very clear, inspections, investigations, ensuring that there's paid sick days, all those other pieces. And I think to the extent that the province has, through various conversations and dialogue, started to warm up to many of those ideas.
Must be frustrating for you, though, when you feel like you have such a clear idea of what does need to be done and you don't see it get done.
Yeah, I'm someone who tends to be an optimist at heart. I think in general, the focus, as I've said throughout, is really trying to work with all the different partners, but a recognition, of course, that at times we may disagree.
Thank you, everyone. Have a safe weekend. We'll get through this, I promise you.
Ontario's premier did eventually walk some of those measures back, but the whole episode raised a truly unsettling question. Was the government listening to its advisors? One of those advisors, Dr. Peter Uni, was haunted by the thought. I've heard you describe it as one of the darkest, if not the darkest moments for you so far in this pandemic. Why did you feel that way?
The first thing I actually really felt is that there was such a discrepancy between what needed to happen and what was happening that pointed towards a real misunderstanding, of the nature of this pandemic, that I just felt like a tremendous failure, personally also. This pandemic in this province being driven by essential workers and their families who are out there, and I just didn't see any of that being acknowledged. And what happened instead of is we closed playgrounds.
Do you genuinely believe at this point that this is a simple misunderstanding?
I don't know. What else is it if not? From my perspective, it's not understanding that the pandemic is driven by indoor space that is unsafe and is driven by people who are unsafe and need to go to work anyway. It's as simple as that. But I'm at a loss still.
When I read in the Globe that you received hate mail, but more than just hate mail, so I'll read this. Greetings, Dr. Lowe. You are a sad excuse of a person, and I want nothing but pain and suffering for you. The same pain and suffering you have caused the citizens of the region, I hope I never run into in person. F you. Do you remember getting that?
I do remember receiving that email. I think I understand, first of all, the frustration that comes from. And I understand that the person is, certainly someone who is experiencing a lot of hurt. The pandemic, I think, has really not been easy on anybody. I mean, certainly you can't help but take some of those words to heart. So, I'll read it, I'll understand where it comes from. I might hurt a little bit, briefly. I always remember that ultimately all of us actually want the same thing. We all want out of this.
There is certainly hope. More Canadians are vaccinated every single day, but there are still those who think a fourth wave is possible. So, the doctor's work continues, guiding the rest of us, carrying the burden of science, and pointing to any dangers ahead.